November is Lung Cancer Awareness Month, and did you know lung cancer is the leading cause of cancer death among both men and women in the United States? But there are advanced treatments and ways to prevent it. Joining me now from Ironwood Cancer and Research Centers are Doctors Ronik, Bhangoo, and Dr. Azam Farooqui. Great to have both of you on Sonoran Living for the very important topic.
Thank you for having us.
Yes, I want to start with you, Dr. Farooqui. As a medical oncologist and a hematologist, how common is lung cancer and what is the mortality rate?
Yeah, it's a great question. And, you already nicely put that it is the leading cause of mortality, cancer-related mortality in the United States. It's actually the second most common cancer, second to prostate cancer in men and breast cancer in women. But it does actually hold the highest mortality rate for both genders. Generally, the American Cancer Society estimates about 200 to 250,000 cases a year and about 130,000 deaths per year as well.
Do you have to be a smoker to get lung cancer?
You don't actually. So the classic traditional lung cancer patient previously was thought to be a smoker, and that's still the majority of cases. But we do have several patients who are non-smokers, and so it raises the importance of being aware of symptoms and trying to catch the disease early.
And Dr. Bhangoo, you are a radiation oncologist. What are the common general treatment approaches there at Ironwood Cancer?
Yes, so for an early stage lung cancer, the primary treatment options generally include surgery or radiation therapy. And radiation therapy is a great treatment option because it's non-invasive, it doesn't require anesthesia. Essentially, a patient just comes in, lies on a table, the machine moves around him, we treat the cancer and then go home the same day. So radiation is a really great treatment option for lung cancer.
We're looking at video right now. You treat all cancers, obviously, but lung cancer is what we're talking about. And there's a new medical therapy you were saying, Dr. Farooqui. What does that entail?
Yeah, so it's a great question. So traditionally we've used chemotherapy for lung cancer, and we still use that. But in this modern day, we actually have some newer novel agents like immunotherapy, targeted biologic therapy, which are specifically designed for certain patients who are eligible, but that are generally gentler and easier to treat. So it really opens up opportunities and doors for other patients.
Yeah, is this a combo treatment that you can do?
We can do them together. We'll do chemotherapy and radiation together frequently. Sometimes we'll do them sequentially, so we'll do some radiation and maybe immunotherapy before or after, depending.
Yeah.
But we can work together for those.
And that's very important. And prevention, obviously, is what we want to remind people. Dr. Bhangoo, are there ways to prevent lung cancer?
Yes, so one of the ways we can do that is by early cancer screening. So you can use a low-dose CT scan of the chest for patients at increased risk of lung cancer. Those are generally your older patients who have a long smoking history. And the earlier we can catch cancer, the easier it is to treat and the higher chance at cure.
And why should patients come to Ironwood Cancer and Research Centers?
Well, we've definitely established ourselves as, being a facility that really empowers patients, really wants to provide patient-centered care, which basically means tailoring and catering our treatment to each individual patient's needs.
Absolutely, and awareness is key, and prevention and treatment. Thank you both for all that you do. We appreciate you. And if you would like more information about lung cancer, including awareness and treatment, Ironwood Cancer and Research Centers has 10 Valley locations. To book an appointment today, please call 480-821-2838 or visit their website, ironwoodcrc.com.